Over the past decade, demographic shifts, coupled with burgeoning economic pressures, have presented severe challenges to providers of health and social care services in the UK.
We've developed a very crisis-focused system in both healthcare and in adult social care, where if you have a really severe needs or crisis, then you get quite a good response. But over time, we've reached a situation where if people have got quite low-level needs, they actually get denied help often altogether until they have a major crisis in their health.
Increasingly, local authorities have been looking to invest in prevention services so as to reduce, delay and prevent the development of crises, rather than simply reacting to them once they occur.
Prevention is a spectrum, so at one end of that spectrum we might be trying in health terms to prevent future cancer by stopping people from smoking in the first place, or helping them to give up smoking if they've already started. We might be trying to prevent future health problems by encouraging children to be healthy in an era of childhood obesity. At the other end of the spectrum, we might be working with people who've got quite significant health and social care needs, who are already using quite large amounts of service, perhaps domiciliary care, and we might be trying to provide more of a rehabilitative, more of a re-ablement approach.
People don't want to become ill, people don't want to lose their independence, and of course for an organisation like Adult Social Care, we don't want to be paying out costly services when an early intervention and prevention would have stopped that happening. So it is, to a large extent, partly because it's cost effective, but it's also what people want. People want to engage in their communities, and many of the services that prevent people becoming unwell are actually the sort of services that people find added value in. They are the things that connect them into their communities.
The benefits of prevention and early intervention are increasingly recognised. However, health and social care commissioners face challenges in moving towards a more preventative approach.
One of the biggest problems we've got is that everyone recognises the need to develop more of a preventative agenda, but that nobody really knows how to do it, and how to do it at pace and at scale. And part of the difficulty is the lack of a significant and a substantial evidence base.
Against this background, SCIE, the Social Care Institute for Excellence, has been commissioned to develop a prevention library, an online resource which will be a knowledge hub for information and resources about emerging practice and related research.
We're really pleased to have been asked by the Department of Health to develop, in conjunction with them and the Local Government Association and the Association of Directors of Adult Social Services, an online hub which brings together the best of prevention practice. If we get prevention right, people can participate in communities for longer, live active lives, contribute to things happening in their communities, using their abilities, their knowledge, their skills to add to community life.
Hosted on the SCIE website, the Prevention Library is intended to support and help inform commissioners making decisions about prevention provision. The library shares knowledge of what works, collating examples of existing prevention services from the public and voluntary sectors, both pilot and established, and includes recent research publications, providing a growing and easily accessible evidence base. Plans for future development include offering a platform where commissioners can interact, sharing knowledge and information around the issues, challenges and successes related to service provision in their local areas. Through the Care Act of 2014, the provision of prevention services has become a statutory duty for local authority commissioners.
A prime focus of the Care Act is on well-being, enabling people to live in safety and comfort in their own homes, which is where most people want to be. So what commissioners of services want is to know what's happening around the country that enables these objectives to be achieved.
The SCIE Prevention Library is really important. It's going to be the first time that we've ever had a really good range of different examples, and some of those have had some really good research behind them, and others were just, they're emerging models that we can just look at examining in further detail.
One of the advantages of resources like the SCIE Prevention Library is it gives you access to a range of different options, so you can go on there, contact people, find other ways of doing things, And what's interesting, some of those interventions are relatively small and cheap, so you think, oh, that's what we can do with that bit of money. Or you can encourage a local group to try and develop services in that area.
An example from the SCIE Prevention Library demonstrates how approaches to prevention can be highly innovative.
Some years ago, we had a vision of how our services could be designed in conjunction with people who use our services and carers.
Halton Day Services is run by the Council for people with learning disabilities, providing daytime activities to help meet people's needs. When two of their community centres closed, Halton Day Services approached Norton Priory Museum and Gardens with the idea of running the kitchen there. The pilot's success has led to an expansion of the project at the Priory to include a fully functioning brewery and bottling facility, as well as a tea room and an ice cream parlour.
Since we have introduced this model of service, we have found behaviour that maybe challenges our service is greatly diminished. People are engaged and focused on every level.
Dairy ice cream.
In Leeds, the City Council has developed a full programme of prevention services over a number of years.
We want to do two things. One of which is we really want to make sure that prevention, keeping people well, is embedded in all services. Really generic important services like home care may be focused on care and support, but again you would expect that somebody delivering home care would be able to spot that somebody was living in a cold house, wasn't getting about as much as they used to, maybe wasn't eating as well, and could signpost them accordingly. But it's also vital to have very specific services targeted at the various populations that we support to help people to keep well, keep healthy, keep active.
An example of a project supported by the Council is the Cross Gates and District Good Neighbour Scheme.
We try to offer as wide a variety of opportunities for older people in the area to socialise as we can. We've got a range of arts and crafts opportunities, creative opportunities generally. We have a walking group, a cross-country walking group that goes out every Monday afternoon, 3 or 4 miles across fields. And we have purely social opportunities like the drop-in coffee morning, where we also push our advice and information service really. We bring in other agencies to support people's independence. So that's what we're trying to do really, we're trying to support independence, reduce isolation and promote wellbeing.
It's something different, and there's some people that never talk to anybody for days on end. Well, they can chat away here.
Oh, I like to go on the trips, yes. It's somewhere to go and it's something different. Where if I didn't go on the trips, I'd be sat at home.
Much of Crossgate's success relies on volunteers from within the local community who assist with running the centre itself as well as transport.
People that volunteer are really, really good, they give their time. Some are older than us.
The role of the voluntary sector in prevention is a significant one. One national example from the library is the British Red Cross, which supports about 450,000 people a year through its independent living services.
The voluntary sector has a huge role to play in providing preventative services. Volunteer-based services can be especially re-abling and preventative. And we all know, for example, that social isolation can have a really big impact upon physical and mental health and well-being. And our volunteer-based services can really support people to regain the skills and confidence that they need to reconnect in their community.
The provision of prevention services, the design of programmes and making the financial case for them can be daunting to commissioners new to this area of service provision. While SCIE will continue to develop the Prevention Library, its success ultimately depends on commissioners both using and submitting material.
The whole area of early intervention and prevention is very, very broad. There is a lot of stuff going on. And I think using the library is a really good sense of, oh, that's working somewhere else. That would work really well in Leeds. That would really work well in Brighton, wherever you're coming from. And that ability to share and learn is really important.
So this is an unashamed plug. If you've got practice that you'd like to share with us, please do so. Give us feedback on how helpful this resource is now, and certainly give us your examples of what works in prevention practice.